first hour. Well, a man police call a serial infector is locked up this morning, accused of infecting patients with hepatitis C. Federal prosecutors say that David Kwiatkowski infected at least 30 people when he worked as a medical tech at Exeter Hospital in New Hampshire. Before that, they say he worked in several other states and that health officials are offering free testing now to thousands of patients. Let's bring in CNN senior medical correspondent Elizabeth Cohen. So, all right, man, that's a lot there for you to help us understand. Right. But first off, right now, what charges is he facing?
He's been charged with obtaining controlled substances by fraud and tampering with the consumer product. That's the formal charge. I'll explain that a little bit. When I was talking to a federal official, she used the term drug diversion. And what that usually means is when healthcare workers have a drug problem, they have a drug. Let's say I'm the doctor and you're the patient, or I'm the healthcare worker and you're the patient. I give myself a little bit of the narcotic and then I give some to you. If I have hepatitis, I could now have given you hepatitis. Or I give myself all the drug, and then I fill it with saline, and I give you saline. And then when you go in to have your procedure that you're supposed to have, they notice that you're not sedated, and they just, give you what you need to sedate you. So that's what drug diversion means. We don't know all the details of what happened here, but it's being described as a drug diversion case.
Okay. So with that said, real quick, so it's might have done it unwittingly, or was it purposeful?
Drug diversion cases are purposeful. I mean, these are people who want to use drugs, and in this case, they're talking about fentanyl. Fentanyl is a very powerful, highly addictive narcotic. And
this person, the infector, we'll call, did or did not know they had hepatitis C. That was the unwitting part.
Okay, he says he didn't know. That's unclear.
Okay, so obviously a lot of details here. You've uncovered a lawsuit, or more details through that?
Yes, there's a lawsuit that some of these patients who become infected, they've filed a lawsuit against the agency that placed him in Exeter Hospital. And so here's some quotes from the lawsuit. So the lawsuit says that in 2008, different hospital, this guy worked in a different hospital, and a hospital employee observed Mr. Kwiatkowski enter an operating room, lift his shirt, and put a syringe in his pants, and exit the room. And then 3 empty syringes bearing fentanyl labels were found on his person. An empty morphine sulfate syringe and a needle were later found in his locker. They then asked Mr. Kwiatkowski to submit to a drug test, which, according to this lawsuit, he did. And the lawsuit says that a drug test found fentanyl and other opiates in Mr. Kwiatkowski's system. So that's what they paint a picture in this lawsuit. Of course, this will all, have to go through the courts.
Right, exactly. All right, so you hear that. So how does something happen like this over and over again?
Right, I mean, he worked in 8 different states between 2007 and 2000.